There are two new additions to the prescription dialog that we'll discuss today. Both of the new fields I'm about to show you were required for us to add to our software by SureScripts, which is the company that processes the e-prescriptions. But good news, neither of the fields necessarily require you to do additional work. Let's go into a chart and take a look. I'm going to click on my Prescribe button and prescribe medication. The first thing you may notice is the new Pending Denied Refills dropdown on the search screen. This field is related to the e-refill functionality that the pharmacy has in place. Remember that whenever a script's refill quantity turns to 0, the pharmacy automatically sends an e-refill request for that medication to your to-do list. This is the equivalent of your office receiving refill requests on the fax machine from the pharmacy. Now, we do have the ability to turn the e-refill feature off, so some of you may not be familiar with it for that reason. For those of you not familiar, let me show you an example. This is what an e-refill request looks like on your to-do list. When you double-click on it, you will see the medication in question in orange on your face sheet. If you right-click on it, you'll have the option to process refill request. At the bottom, you have the option to approve, deny, or deny but new Rx will follow. The functionality that I'm about to show you is only applicable if you select Deny but new Rx will follow. So for those of you that use this functionality, this new field is relevant to you. Let's go back into the original chart that I had open so I can demo this information to you. So when will you use this new Pending Denied Refills field? If you have received an e-refill request for the selected patient within the last 3 days, and you selected Deny but new Rx will follow from the process screen, you will see that medication along with the script details in this dropdown. If you select the medication from the dropdown, it will link the current medication that you are about to prescribe to the request that you previously denied. Basically, SureScripts would like to know that this prescription is the one you said would quote-unquote follow your denial. If you do not select anything from this dropdown, nothing will happen. It is more or less a nice gesture to send SureScripts this information rather than a requirement. Or at least that is how it is for now. We are unsure whether SureScripts will make this a requirement in the future or not. If you received an e-refill request and selected just the plain deny option, you will not see that medication in this dropdown. The medication will only show in here if you selected deny but new Rx will follow. If you have not denied any e-refill requests for this patient within the last 3 days, this field will be grayed out. Also, if you do not have e-refills turned on, then this field will always be grayed out. Next, you may notice that there is some blank space to the left of the medication names. This is because we decided to remove the F that used to be displayed there. The F notated that the medication was coming from First Databank, and if you saw an M there, it meant that the medication was manually added by someone at your practice. You will no longer see the F show up. However, you will still see the M show if you are viewing a manually entered medication, like we see here with compound XYZ. This will not affect how you search or view a medication. I just wanted to mention it in case you noticed it. Now let's see what has changed on the Prescribe dialog. This dialog now has a new field for days supply. This was added in preparation for a clinical quality measure for meaningful use that will need this information. This field will need to be manually entered by the user. The software will not calculate this information based on the SIG that was entered. You will also not receive any warnings if the value you enter in this field is contradictory with the SIG and/or dispense values. Now, that being said, this field is not a required field, and in version 4.7, our software will automatically calculate it for you. So by the end of this year, you will no longer have to worry about manually entering this information. If you do not want to enter days supply or do not need to for meaningful use, then you can skip over it. If you do enter days supply information, you will see it show on the confirmation screen and also when you right-click on the medication from the face sheet. The last addition to the prescribe dialog is the option to select payer. Below the formulary information, you will now see a new drop-down for payer. This information is coming from SureScripts, not Practice Manager. So whatever SureScripts has on file regarding the patient's insurance is what you will see here in this drop-down. SureScripts is requiring that you send this information along with the script. If the patient only has one payer, this field will be defaulted to that automatically, and no additional steps are required. If the patient has more than one payer, you will see those options in the drop-down, and you should pick the appropriate one before proceeding. Even though we will display all payers in the drop-down will be defaulted to the most likely used payer. So if you are unsure which is the correct payer to select, then just leave it set to the default. So to recap, there is now a pending denied refills field on the medication search screen that will allow you to link this prescription to a previously denied e-refill request. There is also now a new field to document days supply, and there is now a payer field that allows you to designate which insurance should be used for this script. None of these fields necessarily have to be used. The payer field is required. However, it will be defaulted to the most commonly used payer for this patient. So if you are unsure, you can leave it at the default in order to proceed. Next up is a simple change to the smoking history dialog. Let's go into a note and take a look. I'm going to click on the smoking history button. Within this dialog, after you select yes to the question regarding whether the patient has smoked at least 100 cigarettes in their life, you will see that we have added two new status options to select from. The new options are heavy tobacco smoker and light tobacco smoker. The definitions of the two statuses are also included. Greater than or equal to 10 cigarettes per day would be considered heavy, and less than or equal to 10 would be considered light. These two new options were added in preparation for Stage 2 meaningful use. Per the final rule, CMS decided to add these new statuses in order to better reflect clinically relevant differences between smokers and to provide options that may be preferable to providers. Now you may ask, well, what is the difference between a current someday smoker and a light tobacco smoker? Or when should I use each one? The answer is simply that it is up to your discretion. Whether you select current someday smoker or light tobacco smoker, for example, is up to the provider. Either one are acceptable answers to this question and will get you credit for the core meaningful use measure. So to recap, CMS has decided to give you additional options to document the patient's smoking status. Remember, if you select yes to the question as to whether the patient has smoked 100 cigarettes in their life, then you must follow that up and document their current status in order to get credit for the applicable measures. The next update is to the newer enhancement that we talked about in our 4.5 course, recalls. Let's go ahead and open the chart and find our recall button. I'm going to click New to add a new recall. We have updated this dialog to make it easier to select or find a recall date. Remember that when you are entering a recall for a patient, you must select a date to which they are to return to your office. Previously, you only had the option of typing in the date or selecting it from the calendar. Now you will have the option to quickly select from the pre-configured time periods of either 1, 3, 6, or 12 months into the future with one click of the corresponding button. So for example, if the patient is to return to your office in 6 months, you will click the +6 button and the appropriate date will automatically populate the recall date field. Or if you need to select a time period other than 1, 3, 6, or 12 months, you can use the Advance field right below to manually select the time period you are looking for. So if you wanted the patient to return in 8 weeks, you could select 8, then weeks from the dropdown, and click Apply. This will automatically populate your recall date field with 8 weeks from today. This new feature will be available whether you are entering a recall through Clinical or Practice Manager. So that's it. To recap, we have added 2 new options in order to make selecting the recall date faster and easier. You can either click the +1, 3, 6, or 12 buttons to select any one of those common time periods, or you can use the Advanced fields to manually find any time period in the future. This update is relatively basic and is related to checklists and picklists in Template Editor. Let's go to Template Editor and modify the properties of a checklist to demonstrate this new functionality. I'm going to right-click on my pick list and go to Edit Properties. Within the finding of a pick list, you have the option to tag your information to a condition in the database. Tagging information through a pick list or checklist gives you the ability to output that information on the face sheet of the patient's chart if desired. Previously, you were only able to tag the finding to a condition designated as a result. A result would typically be something of a numeric value, a lab result or a vital sign or something of that nature. With the latest change, you will now have the ability to tag the finding to a procedure as well as a result. When you click Tag and receive the search dialog, this dialog will now display both conditions configured as results and procedures. Without getting too much off topic, I just wanted to highlight what this functionality actually does. So let's take a quick look. This template has both a checklist and a pick list with tagged conditions. For example, you will see my health maintenance checklist has a finding to document when a mammogram was completed. If I right-click and edit properties, I will see that it is tagged to the mammogram procedure. Before this update, I would not have been able to do this example since a mammogram is considered a procedure. The other examples here were set up in the same manner, linked to the appropriate procedure or result in the database. Now, if we go and open a chart so that we can enter some information, I'm going to go ahead and open up my checklist, click on mammogram, and then the option to select a date. I'm going to go ahead and type in some information and hit OK. Once you click OK to your checklist, that information will then output on the face sheet. Now, in order for this to work, beyond tagging the condition in your template, you would have first had to create the new section on the face sheet and then tag the conditions to that section. I'm not going to cover the steps in detail of how to tag conditions to the face sheet. However, you can find information in the help files, or you can call customer support. So going back to what we were originally talking about and to recap, we now have the ability to tag procedures as well as results in a pick list or checklist. This functionality allows you to tag information to the face sheet to create custom sections of information. Now let's discuss the changes to the Meaningful Use dashboard. The dashboard is accessed through Reports and then Meaningful Use Dashboard. There are two additions to this dialog, the first being the option to view the number of unique patients. This option was added because the CMS final rule for 2011 states that you must have an electronic medical record for 80% of the unique patients seen during the reporting period. So we needed to give you a way to figure this out without having to manually calculate it. If you select the box next to ChartMaker Medical Suite Unique Patient Count, you will see a new line appear at the top of your measure list to the right. Then you would change your reporting parameters and click Calculate to see your statistics appear. You will want to make sure that your result is higher than 80% before attesting. In this calculation for unique patient count, the denominator represents the number of unique patients that had an encounter code entered in Clinical or Practice Manager, while the numerator only includes the unique patients with encounter codes entered through Clinical. This allows you to determine if 80% of the unique patients seen during the reporting period have an electronic medical record, and thereby whether or not you can successfully attest for meaningful use. There are a couple side notes that should be mentioned with this. First of all, please note that if you are not entering notes in Clinical with appropriate encounter codes attached, this will not provide an accurate percentage. Also, do not expect the denominator for unique patient count to be the same as the other denominators for performance measures, etc., since those denominators only look at information entered through Clinical, whereas the denominator for unique patient count takes into account both Clinical and Practice Manager. In most cases, the denominator for unique patient count will be higher than the others. The next addition to our dashboard is the ability to select which information you see on the reconciliation report. Previously, the reconciliation report only showed you the patients that did not make the numerator. Now we have included the option to see the patients that did make the numerator in case you need this information to troubleshoot any issues. After selecting the measure in question at the top, you would select the appropriate checkbox next to the item that you would like to see on the report at the bottom. You can select both if you prefer. If you do that, the reconciliation report will show you a list of the patients not included in the numerator first, and then the list of patients that were included in the numerator after that. The patients that were not included will show in red, while the patients that were included will show in green. Okay, so two new additions to the dashboard. The first is the option to calculate the number of unique patients seen during the reporting period. The benefit of this enhancement is so that you know whether or not you have 80% of your patients seen in the EMR. And the second enhancement is the ability to see the patients that were included in the numerator when running the reconciliation report. Okay, so that sums up the changes to the dashboard. Now let's move on to a brand new feature in the software, Diagnosis SnoMed codes. First, let me give you a little background on what SnoMed is. SnoMed stands for Systematized Nomenclature of Medicine Clinical Terms. In layman's terms, SnoMed is used similarly to how ICD-9 or CPT codes are used for diagnoses and procedures. It is a numeric way to define medical terminology. Except SnoMed takes it to the next level. It is considered to be the most comprehensive healthcare terminology in the world and is what the EHR world will be moving to in the future to define clinical findings, since it allows for a consistent way to store and aggregate clinical data while reducing the variability in the way the data is captured. The primary purpose of SnoMed is to encode the meanings that are used in health information and to support the effective clinical recording of data with the aim of improving patient care, which we all know is a main goal with the Meaningful Use program. So that being said, you will most likely hear a lot more about SnoMed in the future. Currently, there is one area within clinical that you will see SnoMed introduced and will want to start using if you're planning on attesting to Stage 2 Meaningful Use, and that is the diagnosis screen. So let's open up a chart and take a look. I'm going to scroll down and find my diagnosis checklist and click on a diagnosis. Towards the bottom of the dialog, you will now see a SnoMed section. When you open this dialog, if there was a one-to-one matching from the ICD-9 to SnoMed, which by the way will occur about 60% of the time, you will see the SnoMed already attached like we see here. If you feel the SnoMed code is appropriate, then there is no additional action required on your part, and you can proceed as usual. If the diagnosis has a one-to-many relationship between the ICD-9 code and the SnoMed code, the field will be blank by default, like we are seeing here with COPD, and it will tell you that multiple mappings are available. If you do not want to link a SnoMed code to this diagnosis, you do not have to. Clinical will still allow you to select a diagnosis without attaching a SnoMed code. However, if you would like to select the appropriate SnoMed code, then click Select. This will take you to a search screen that will automatically show you the list of SnoMed options for this ICD-9 code. If you find the option that best describes this patient's condition, then you can highlight it and click OK. Otherwise, if you do not see what you are looking for here, then you can click Search and continue to search for the correct code. I'm just going to select one of the options we see here and click OK. If you feel that this SnoMed code will be used with the majority of your patients that are given this diagnosis, then you may want to select Set as Default so that it will already be linked the next time you use this diagnosis for any patient. The Set as Default functionality is per user. If you had previously defaulted information and have since changed your mind, or if you just want to get rid of the SnoMed code that is attached to this diagnosis, then click Clear. The SnoMed code will not print in your note. The only place beyond this diagnosis dialog that you will see SnoMed for now is the History tab. As of now, there have been no talks about insurance companies adopting SnoMed, so it is pretty much just for incentive program purposes. So if you have no plans to do meaningful use, PQRI, or any other information exchange, then you do not need to implement this quite yet. So to recap, you will now see a SnoMed option on the diagnosis dialog, About 60% of the time, the SnoMed code will already be linked for you. For the remaining 40% of the time, you will want to click Select to find and link the appropriate code for the current patient. The last thing that we're going to talk about today is the addition of the medication reconciliation button. Medication reconciliation is a meaningful use requirement. In Stage 1, it was an optional menu set measure. However, in Stage 2, it becomes a required core measure that needs to be performed on 50% of the patients transitioned into your care. Previously, users were documenting that they performed the reconciliation by adding a CPT2 code of 1111F or 1110F into their progress note. To support ease of use, now all you will have to do is to access the new Medication Reconciliation button to document this information. Remember, after upgrading to version 4.6, you will first need to add this button to your template through Template Editor. If you do not have these privileges, please contact customer support. From within the Medication Reconciliation button, you will first have the option to document whether the patient was transitioned from another care setting or whether they were referred to you by another provider. You need to select yes to one of the first two questions in order to get credit for the measure. You also then need to select yes from the last question of whether or not you completed a medication reconciliation for this patient. By selecting yes to one of the first two questions and yes to the last question, you will eliminate the need to add the CPT2 code to your note. However, if for some reason you do not like this new functionality and would prefer to continue using the CPT2 codes instead, you may do so and still get credit for the meaningful use measure. When you click OK, you will see the appropriate information populate your progress note. Only the questions you answered yes or no to will show up in the note. If you left one of the first two questions set to not asked, that question will not print in your note. So that about sums up the new medication reconciliation functionality. Remember that with the addition of this new functionality, you will no longer need to use the CPT2 codes in order to get credit for this measure. However, you can continue to use them if you prefer that over this new button.